Hi, welcome to Pollock Clinics. I'm Dr. Pollock. You're about to watch a short educational video, after which a physician will be in to see you, review your questionnaire, examine you, and answer any questions that you may have. You have a folder of information in front of you, and if you haven't read it already, when the video is complete, please read all the information in your folder carefully. Erectile dysfunction is a very common condition. In fact, it affects 50% of men over 40 years of age. And as men age, with each subsequent decade, it affects a greater percentage, so that by the time we're in our 70s, 80s, virtually all men will be experiencing some degree of difficulties getting and maintaining erections. So it's good that you've taken the first step and come to see us, because effective treatments are available for you. So we are a treatment center for erectile dysfunction. We treat the problem, not just the symptoms. Some medications that you might take, for example, may transiently dilate the blood vessels for a number of hours, sometimes a day. However, with our treatments, we actually make changes to the anatomy of the penis, enhancing the blood flow. That will allow for bigger, stronger, harder, longer lasting erections that will allow you and your partner to have more satisfying sexual experiences. So at our center, we provide 3 different modalities of treatment. I'll explain shockwave first. It's a virtually painless energy source that works from the outside in on the penis. The energy will stimulate new blood vessels and enhance blood flow to the penis. Secondly, we offer PRP, also known as platelet-rich plasma. That is a chemical way. When I say chemical, I mean it takes your own platelets, concentrates that, and it's re-injected into the penis, rejuvenating the penis as those platelets break open and release proteins that recruit stem cells, allow for enhanced blood vessel regrowth and nerve regeneration, all promoting significant blood flow to the penis, just like shockwave. Thirdly, we offer a sex therapist. Why? Because when men have a few episodes of erectile dysfunction, they start to get performance anxiety. Their brains start to say, it's not going to work, it's not going to work. And they're distracted. So a sex therapist, should you choose to consult with ours, will help you get your brain working with you instead of against you in a sexual experience. So our program at this clinic is based on scientific studies published in medical journals. These studies have been done on thousands of patients and have demonstrated the effectiveness of shockwave and PRP in treating erectile dysfunction. I should also mention that having your family doctor refer you to a cardiologist would be a prudent idea. And that's because often erectile dysfunction is an early warning sign for low blood flow to the heart. So maybe having a stress test through a cardiologist would be a prudent choice. As well, pornography-induced erectile dysfunction has to be mentioned because it now is probably the most common cause of erectile dysfunction in younger people and also impacts men of all ages. Because of pornography watching, the chemical balance in the brain as it relates to getting and maintaining erections is thrown off. And men will find it more difficult to get and maintain erection with pornography exposure. It takes the brain about 2 to 3 months to reset the chemical balance. So shut off pornography and then expect that within 2 to 3 months that the impacts should be significantly relieved. So there's no magic bullet to treat erectile dysfunction. I like to explain our approach here as a three-pronged approach. There's the effective treatments I described that we can provide for you, the shock wave, the PRP, and the sex therapists. Then there's the things that you can and should do for yourself. And then there's those things that your doctor can do in partnership with us to monitor and treat related conditions that can cause erectile dysfunction. So let's come back to our treatments. As I've described, the shock wave treatment and the platelet-rich plasma treatment are the physiological treatments. They will improve blood flow to your penis. They will provide bigger, harder, stronger, longer-lasting erections, and therefore enhance sexual satisfaction for you and your partner. The sex therapist is effective for the psychological side. So now with the things that you can do for yourself, let's break those down into number one, diet change. If you can move more towards a vegetarian diet, eliminating the animal fats and proteins from your diet, that will improve your circulation. Secondly, you can reduce your weight. That also promotes better circulation. And third, getting to the gym or enhancing in many different ways your aerobic exercise and your weight resistance training through things like weights in a gym, both of which will enhance and improve your circulation and therefore blood flow to your penis. And fourth, as I mentioned, shutting off all pornography. And the third prong of the treatment, as I alluded to, is having your doctor make sure that things like your blood sugar, cholesterol, blood pressure are all monitored and treated properly if they are abnormal. As well, things like sleep apnea, not sleeping at night, stopping to breathe, that can also be a contributor to erectile dysfunction. Other issues like depression, thyroid problems, medication side effects from things like beta blockers, or smoking, drinking too much, or too much stress. All these things need to be dealt with through your family doctor and can be contributing factors to erectile dysfunction. So if you're like many of our patients, you might be wondering, well, should I get one treatment, both treatments, neither treatment? This is really dependent on your goals, objectives, the investment that you're comfortable making in your sexual health. So if you said, you know, doctor, I don't have a lot of extra money. I really am looking for more temporary, less expensive options. So we would steer you more towards medications like Cialis, Viagra that could work temporarily for you, and other choices like urethral suppositories or the trimix injection in the penis that you would take every time before a sexual experience. There are penis rings that can promote erection. There's also even an implantable device that can be put in the penis. Most of our patients find that this is not an optimal route to go and are looking for a more long-term solution. And if you said that your goal is to have the best sexual function, the best possible erections that you can have for as long as you can have them, as many years as you can have them, then we would steer you more towards our treatments. And most patients who are searching for optimal function will choose the shock wave and the PRP in combination. And that's understandable in as much as if someone wanted to lose weight, they might choose diet and exercise. While one or the other might work, the combination is evidenced to be possibly even more effective and for a longer period of time. People also ask, what are the side effects and risks of shockwave and PRP? Well, thankfully, there aren't a lot of risks with these procedures. There's very few serious side effects, and if any occur, they are very infrequent. So I like to explain that the risk is really that you might be in the small group of people that don't get the result that you're looking for. And then you will have spent your hard-earned money and possibly be unhappy. However, with a bit of luck, you'll be in the large group of people that get a very good result and get a great improvement in their erection and improvement in their sexual satisfaction. And that group is probably about 2/3 or 70% according to the studies. The problem is I can't look at you and tell you what group you're going to be in. But I can say that we have many, many people that we treat in our clinic who leave completely satisfied and very happy with the improvement they're having in their abilities to get and maintain their erections, and therefore are having much more satisfying sex, both for themselves and their partner. Patients also wonder, how long can the treatments last? Well, the good news is that studies do support that the treatments we give you can last for years. But here's the issue. Once you get the treatment, you need to continue to take care of yourself in the ways that we described earlier in the video, because that will optimize the treatment and prolong the time that it's effective. As well, your doctor needs to make sure that all the medical conditions that can contribute to erectile dysfunction are also being managed effectively. Regarding the success rates of our treatments, studies demonstrate that both shockwave and PRP alone have about a 2/3, 70% response rate, meaning that men will see a significant improvement in the quality of their erection. However, most of our patients choose a combination therapy, combining both shockwave and PRP. And it's reasonable to infer that that will provide even a greater success rate, possibly for a longer period of time. And that is in the same way that diet and exercise, as I alluded to, may help with weight loss, as opposed to just choosing either diet or exercise. While studies demonstrate that the PRP and shockwave treatments are highly effective, I'd like to give some examples of men that are good candidates and less favorable candidates, and let's start with those. So if I see a gentleman who's 25 or 30 years old who had a perfect erection last week, but has a new girlfriend and now a week later can't achieve an erection at all, I would deter that gentleman from pursuing our treatments and go more towards the psychological treatment with the sex therapist. Similarly, if we were seeing a 75 or 85-year-old gentleman who just had a radical prostate surgery and it wasn't nerve sparing, and he had all the nerves cut that were innervating the penis and now could not achieve an erection at all, I might suggest to that patient there is significantly less chance that he should pursue and would respond to our treatments. Now, as far as who would make a good candidate, there is just in general the aging male, an individual without any abnormalities in his cholesterol, blood pressure, diabetes, but just with advancing age. is finding that he's having progressive difficulties getting or maintaining erection. And we see those gentlemen ages 30s, 40s, 50s, all the way up to 90s. Also, gentlemen that are suffering from a very definitive vascular source. And that is, as I mentioned, when they do have high cholesterol, high blood pressure, diabetes, and numerous other conditions that impair blood flow to organs including the penis. The treatments do work especially well. They're actually designed to treat vasculogenic ED. Patients often ask me about the relevance of testosterone and whether it's indicated to check their testosterone. And first, let me discuss how we go about getting the proper active testosterone measurements in your blood. There's a lab requisition that you'll be given. And on that requisition, we test not only total testosterone, but the free testosterone, bioavailable testosterone, and sex hormone binding globulin. Now, if you've ever had your testosterone checked before at the lab and you didn't pay any fee for it, then you only would have had your total testosterone checked. Unfortunately, that's notoriously inaccurate in allowing us to diagnose a true testosterone deficiency. So we will, for completeness sake, get a full testosterone panel for you. And that'll allow us also a baseline now and for the future on your testosterone levels. Now, I also want to be clear on why we're checking your testosterone level. So diagnosing and treating testosterone deficiency won't fix your issue with erectile dysfunction. We explain it more as a hardware and software problem. In other words, when men are low in testosterone, they just experience a multiplicity of vague symptoms, some of which may contribute to the psychological elements like sex drive, energy, fatigue, muscle mass, tendency towards obesity. Low testosterone may lead to irritability, depression, cognitive changes. You see, all these things don't directly affect your erection. And that's why by assessing and treating a low testosterone with testosterone supplementation won't fix your erection. For this hardware problem that we call erectile dysfunction, we actually need to change the blood flow to the penis and physically change the anatomy. And that's why we need the shock wave and the PRP, which do exactly that. So why check testosterone? Well, we want to check it because of the multiplicity of symptoms that it can cause, the fact that it very often is missed, and you're here to see us in the context of your sexual wellness, and because of the symptoms like sex drive and the other sort of generalized symptoms, we feel it's prudent to get a baseline on your testosterone as well. You don't need to wait to get the results back before you consider any treatments because, as I say, low testosterone and treating it will not fix your erectile dysfunction. So this completes our educational video. Thank you for taking the time to watch. Our treating physician will be in momentarily. And if you haven't already, please take a few minutes to finish all the reading in your folder. Thank you for your patience. We do know that you're here. Once our doctor comes in to speak with you, we will make sure to find the optimal treatment program that's best suited for you. Thank you.